Welcome to our session, CX Network in Action, Transforming the Patient Experience with Innovative Digital Services. I'm Joanna Gorovoy, and I'll be kicking off our session today by providing a brief overview of what's driving a need for wider data sharing, greater ecosystem collaboration, and co-innovation in healthcare right now, and how healthcare customer experience networks enable value-based digital transformation and better clinical cost and quality outcomes in healthcare. Then I'll be handing things off to my colleague, Laura Heritage, who will be providing a deep dive into the technology that enables a more connected, engaging healthcare experience, and she'll present a short demo that illustrates how organizations can get started with building CX networks today using FHIR and other healthcare APIs to more widely share data and facilitate patient engagement leveraging mobile and IoT technology that's in patients' homes today. And with that, let's get started. The healthcare industry is accelerating its shift towards value-based care, driven by a combination of industry forces, which include rising cost burdens, an explosion of data, and increased mobility. The healthcare ecosystem must adapt to address things like evolving government policy that enables and prioritizes this value agenda, a rise in healthcare consumerism as consumers bear more risk and face higher out-of-pocket costs for healthcare, ongoing digitization of records, workflows, and services that enable value-based care delivery, and new market entrants that are often non-traditional and are faster and nimbler to introduce disruptive models and capture new profit pools. All of these industry and systemic forces are starting to come together right now and are really challenging the status quo in healthcare. And so what we're seeing is a greater demand for value-based, personalized healthcare products and services. But although there's been a push toward digitization and system-wide connectivity in healthcare, what we continue to see today is that as a patient interacts with all of the different organizations along the patient journey, this experience is broken and remains very disconnected. And that's because the healthcare customer experience is quite unique in that it involves many different stakeholders. And this lack of a connected experience across the patient journey inevitably has an impact not only on the patient experience, but on things like accessibility, quality, cost, and efficiency of care. Common data challenges in healthcare, such as interoperability and the prevalence of data silos within and across organizations, along with heightened data privacy and security requirements, make it difficult to create this connected patient experience and provide a unified patient view. As healthcare adapts to a rise in healthcare consumerism and demands of value-based, outcome-driven care models, maintaining the status quo is no longer an option. Health systems, health insurance companies, pharmacies, and other organizations across the patient journey will be forced to collaborate and will find value in co-innovation so that they can deliver the new services and experiences that consumers are expecting, and to achieve better outcomes. So as we look to a future where we have activated this digital thread that better connects all stakeholders along a patient's journey, there's an unprecedented opportunity to deliver a more personalized, engaging healthcare experience. So what do we mean by this? Well, we have an example here depicting the variety of organizations a single patient might interact with on a regular basis to manage different aspects of their care. And you can start to imagine the possibilities if all of the data challenges we mentioned earlier were overcome and organizational silos stifling collaborative innovation were also dissolved. A customer experience network, as defined by research from IDC, results when an organization connects and embraces co-innovation from entities in a customer's journey, including customers, employees, business partners, and suppliers, all collaborating and co-innovating to deliver improved customer experiences and customer journeys. In healthcare, a CX network centers around the patient and could include hospitals, health systems, payers, and pharmacies, as well as medical device companies, pharma, consumer wearables, and even genomics companies, all of which play a role in shaping the patient experience. From a technology perspective, APIs are really changing the game when it comes to supporting collaborative innovation, and they're the foundation for building CX networks. And with increased adoption of the FHIR standard in healthcare, API usage across a variety of use cases is becoming more prevalent. So let's take a look at some examples of the value and outcomes tied to building CX networks in healthcare. A large health system could leverage APIs to enable controlled access to patient data from continuous glucose monitors and fitness wearables to enable personalized and timely interventions for chronically ill patients, improving patient engagement. Adding a large pharmacy chain to the customer experience network provides an opportunity to streamline the medication management and adherence workflow by enabling requests from the provider, approvals from a pharmacy benefits administrator, and even voice-enabled ordering, refills, and reminders using technology such as Amazon Alexa to become more automated, improving medication adherence. Improved data sharing across the ecosystem also enables healthcare insurance companies to not only make the claims process more efficient, but to also quickly deliver new personalized and value-added services for their members, to encourage them to become more engaged in their health plan and reward them for taking preventative care measures and reducing cost. So as you can see, the benefits of greater data sharing and collaboration and co-innovation resulting from a CX network in healthcare are many. But next we're going to zoom in on one particular use case around medication adherence to show you how you can get started today with generating value and outcomes from CX networks. Medication adherence is a huge problem for our U.S. healthcare system, costing upwards of $300 billion per year. And it's a difficult problem to manage given the lack of a unified real-time view of the patient across different providers, pharmacies, and other stakeholders. Keeping patients engaged through digital tools is an area with tremendous potential, but one that also requires collaborative innovation in order to be effective. So I'm going to hand things off to Laura Heritage, Director of Product Portfolio Planning at Axway, who will share a brief demo of how a CX network in healthcare, powered by Axway's Amplify platform, helps to address the issue of medication adherence for chronically ill patients.
For this demo, we are going to use a fictitious healthcare company called Griffin Healthcare. Griffin Healthcare is creating a connected experience for their patients to keep their patients engaged in their care plans. In this demo, we are going to use an Amazon IoT button simulating a smart pill bottle, a mobile phone, and the Amazon Echo. The objective of Griffin Healthcare is to create a connected, engaged experience for Griffin Healthcare's patients and their families while lowering medication adherence costs and improving patient outcomes. Griffin Healthcare has adopted Axway Amplify to build out their patient engagement ecosystem. As we all know, there are many organizations that contribute to the successful patient outcome. This slide here shows an example of what Griffin's patients ecosystem might look like, connecting to pharmacies, connecting to health insurance, connecting to caregiver services. Amplify is a data integration and engagement platform. Amplify allows Griffin Healthcare to rapidly build, secure, manage, and socialize APIs such as HL7 FHIR in an ecosystem, allowing partners to quickly find and connect. Axway Amplify also allows Griffin Healthcare to build engaging applications while providing deep insight. The Amplify components we use to build this demo are API Builder. This is a component where we created the APIs, leveraging connectors such as the Twilio connector for SMS and a NoSQL connector. After the APIs are built, they are deployed and run in our elastically scalable infrastructure. We then secure the APIs with the API manager. We socialize the APIs in our API portal, and we use analytics throughout the infrastructure to monitor the health of the API and to gain insight. In this demo, we will check on the patient leveraging Amazon Alexa. We will log a medication dosage that we took, and we will get a medication history. And you can see that those APIs, those will all be made during API requests. They'll go through the API manager to be secured, and then they'll hit the backend APIs, where you can see that we leveraged our API builder to build the APIs, and it's running on our API runtime that elastically scales. To build the APIs, like I said before, we leverage Twilio and a NoSQL connector. And later on in the demo, we will see the API portal where we can play and look at the FHIR APIs. Let's begin our demo. During this demo, I'm going to be simulating a couple different roles. The first role is I'm going to be a concerned relative wanting to keep tabs on whether grandma is taking her medication or not. So when I have a chance, I ask the Amazon Alexa to check on grandma. I'll do that right now with my Amazon Echo. Alexa, ask Griffin Healthcare to check on grandma.
Hello, Laura. Grandma has missed the last dose of Tylenol 3 and was notified. The last dose taken was on October 12th, 4:31 p.m. Please check on grandma.
So that doesn't sound good. Grandma missed her dosage that she was supposed to take. So I should probably call grandma or have someone go over and check on grandma to make sure she's taking her medications and nothing else is wrong. Now I'm going to switch my role and I'm going to become grandma. Now, when I miss my dose, I will receive a SMS. Now I have an old flip phone here on the screen, and the reason I do that is while my grandma is 90 years old and she actually uses Amazon Echo and speaks to it to get the latest sports scores and so forth, she still has her flip phone and she still texts the old way. I can't believe it, but that's how she likes to do things. So we let her do it. So with that, when I was introducing the demo, grandma got her message on her phone, except I'm going to show it show the actual message that she would have gotten on my smartphone, but she would have received this on her mobile, her flip phone, her little mobile flip phone. All right, so I'm going to bring this over here so you can see this. So I'm projecting my screen right now for my iPhone, but grandma has a flip phone. So she says, did you miss your dosage of medication? You should probably take it. So it's a good reminder to have her take her medication. So now as grandma, I am going to want to check my history. So what I'm going to do is I'm going to double click my IoT button to view my last history. So let me get my iPhone. So that's up there. And now if you look up on the screen, here's the IoT button, and I'm going to give it a double click. You can see the button go from white to green, and that means it's successful when it sends. And it'll take a minute. And there we go. Now you can see, oh, I didn't take my medication, so I better do that. Let me click on to the next page. So on the next page, I'm going to simulate taking my medication, and then the pill bottle, the smart pill bottle, will perform a one click and take it. So here is the IoT button again. I'm going to give it a one click, and you can see it blinking white, and then it'll go green. Oh, I better bring up my phone so you can see it when it comes through. And I did that just in time. And I must have clicked it twice because I got 2 alerts there. Actually, no, sorry with that. The one, the first here shows that when I click it once and I take my medication, I get an SMS that tells me, okay, well, I should have 3 doses remaining, and to remind me, okay, you need to take this again in 2 hours, right? So I get that SMS message. And then because I only had 3 doses remaining, Griffin Healthcare put it into their system that they will automatically fulfill your prescription with your pharmacy of choice. And here you can see they chose to do Walgreens Pharmacy for the refill. Okay. So now if I switch back to the persona of the relative, I can talk to the Griffin Healthcare through Alexa to see if she's taken her medication after I told her to. Alexa, ask Griffin Healthcare to check on Grandma.
Hello, Laura. Grandma has 10 doses of Tylenol 3 remaining. The last dose was taken at October 19th, 10:48 a.m.
Thank you. So we heard that Grandma has taken her medication, and it sounds like her medication got refilled because she now has 10 doses remaining. So everything is great. So Griffin Healthcare really created this engaging ecosystem and experience for not only the patient, but for the patient's relatives to check on it. We can expand this, now that Griffin has this ecosystem, they can expand this ecosystem and add even more things in. How many people out there have Samsung Smart Things or Nest thermostat? You can hook into those APIs and do things like when I ask Alexa to check on Grandma, tap in to see if there's been any movement into the house, right? So maybe with the next time you ask Griffin Healthcare to check on Grandma, it might say, Grandma has not taken her medicine since 4 p.m. yesterday. Would you like me to send her another reminder? And we have not registered Grandma's movement in the last hour. Would you like me to notify the care services to check on her? So there's all sorts of things that Griffin Healthcare can now do by plugging into the amplified data integration and engagement system, really linking the data with the engagement to create that personal customer experience, patient experience in the making. Now I'd like to show you how some of the components that we use to build the API in a little bit more detail. We're just going to take a quick tour of the runtime aspects of the API in the platform. To get started building your API, go to platform.axway.com. Get started for free. Start building. Go to marketplace.axway.com to look for your connectors. They're all right there, easy to use. Really just go and get started. When I'm logging in here, this is the platform console, and I'm going to be looking at my dashboard so that I can monitor the health of my APIs. So I'm going to look for my API. There we are. So this is the dashboard of my API. It basically tells me, this is the production URL of where you can hit it, the 2 containers. I've got 2 containers. I'm at, less than 1% of the CPU load and so forth. Some interesting data there. I can see analytics over the last 24 hours about my API. I can go the last 30 days and so forth, the different calls, the paths. I can view the logs of my APIs. And this is all, again, in platform.axway.com. And as I said before, if you're building an API, you're going to want to leverage some of the connectors that we have in our marketplace, and you can click marketplace.axway.com. The next thing I want to look at to show you is the portal. So as I mentioned earlier in the presentation, we leveraged the API manager to secure the API and leverage the API portal to socialize and manage consumption of the API. So we're going to log in and look from a portal perspective. So here I'm going to sign in. This is our portal. You can innovate us, Axway's API platform for healthcare. And you could brand that however you'd like, but we left it generic. So I'm going to log in. And here are the two apps that I have registered, the Genomics app and the Griffin Healthcare. You have to register an app and subscribe to the APIs to be able to use it. And that's where you configure things like your security, if you're going to be leveraging OAuth and all that stuff, all the normal stuff you do with consuming APIs in any API portal. Here you can see a list of all of our endpoints. So these are Fire-based endpoints. We can secure any Fire-based endpoint, Fire APIs that you build on our platform, leveraging our API runtime, or Fire APIs that are, for example, from the Happy Fire server. So I'll just click one of these. Let's do observation, since we were leveraging observation in the demo. And let's just take a look, and we can say get. Let's say we just want to get all of our observations. Oops, we're going to have to select an API key that we're going to want to try it out with. We're going to use the Genomics one. And what you can see here is it comes back from with HL7 Fire, that this is a bundle and so forth. So very good. You can test out your APIs in here, see how they work with the proper security, and make it easy for your partners to connect and to begin participating in your ecosystem. Another quick thing that I want to show you is that, during the demo, we leveraged the IoT button, Amazon IoT button, and the Amazon Echo. You can leverage the API builder, which previously was known as Arrow, as the basis to build your Alexa skill. It makes it so easy to rapidly build out and iterate over your skills. If you haven't done that before, if this is going to be your first Alexa skill that you're building, I'd highly suggest you take a note of this particular blog and review how to build an Amazon Alexa skill. Let's go back to the presentation here. The last thing I want to show you is, as an enterprise architect or as an architect in your company, you wonder how the Amplify platform fits within your existing infrastructure. Where can it snap in? Do you need the whole thing at once, or can you actually snap it in? The good thing is that you can actually snap in the Amplify platform. And what we see here is that what's in the gray boxes here is your, what I call your traditional enterprise reference architecture. Most everybody we work with has an existing ESB layer. They have an existing application layer, information management layer. They have their own identity and access management, single sign-on, and your business intelligence and other components. But the Amplify platform can easily snap in, leverage those components, and unleash them into the engagement platform, the data and engagement platform. During this demo, I just wanted to point out the API. We leveraged the API build. We leveraged the delivery channels of the virtual assistants. We leveraged IoT devices from the Amazon IoT button. We leveraged the API and security gateway. We leveraged the portal services. And we also leveraged our microservices infrastructure to run our API once we built the API. So this is the reference architecture of an engaging digital enterprise. One of the other things that I wanted to mention out before we leave this is Axway has a marketplace where customers, partners, and developers can co-create together in that marketplace and share assets and share service accelerators. A lot of the assets that we leveraged during this demo was accessed from the marketplace. Additionally, we have a vibrant API community and engagement community of developers that are ready to be there and help you. With that, I'd like to thank everybody for watching this demonstration today. And if you have any questions, please let me know.
Thank you, Laura, and thank you to everyone in the audience for your time today. If you'd like to learn more about Axway's solutions for healthcare, please visit axway.com/digitalpatient.